Polycystic kidney disease, or PKD, is a serious genetic disorder. It causes numerous fluid-filled cysts to grow in the kidneys. These cysts are different from simple kidney cysts. Simple cysts are usually harmless. PKD cysts, however, can change the shape and function of the kidneys. This often leads to chronic kidney disease, or CKD. In some cases, it can even lead to kidney failure. PKD doesn't just affect the kidneys, it can also cause problems in other organs. These include the liver, pancreas, and blood vessels in the brain and heart. The growth of these cysts is a gradual process. Over time, they can enlarge the kidneys significantly. This can cause discomfort and pain. More importantly, these cysts interfere with the kidney's ability to filter waste products from the blood. This leads to a buildup of toxins in the body, causing a range of health problems. Early diagnosis is crucial for slowing down the progression of the disease and managing its symptoms effectively. The genetic nature of the disease means that it can be passed down through generations. There are two main types of polycystic kidney disease: autosomal dominant PKD, or ADPKD, and autosomal recessive PKD, or ARPKD. ADPKD is much more common than ARPKD. It usually develops in adulthood, typically between the ages of 30 and 50. However, symptoms can appear earlier or later in life. ARPKD is much rarer. It is usually diagnosed in infancy or childhood. This form of PKD is typically much more severe than ADPKD. Children with ARPKD often have serious kidney and liver problems. ADPKD is caused by a mutation or error in either the PKD1 or PKD2 gene. ARPKD is caused by a mutation in the PKHD1 gene. Understanding the different types of PKD is crucial for diagnosis, genetic counseling, and treatment. It helps doctors determine the likely course of the disease and provide the most appropriate care for each individual. Polycystic kidney disease often goes unnoticed in its early stages, as symptoms can be subtle and easily mistaken for other conditions. However, as the disease progresses and cysts multiply, individuals may start experiencing a range of symptoms. One of the most common symptoms of PKD is pain. This pain is typically felt in the back, just below the ribs, where the kidneys are located. It can also manifest as a dull ache in the abdomen. Another telltale sign of PKD is blood in the urine, medically known as hematuria. This can be alarming, but it's important to note that not everyone with PKD will experience this symptom. Changes in urinary habits are also common in PKD. Individuals might find themselves needing to urinate more frequently, especially at night. High blood pressure, also known as hypertension, is another prevalent symptom of PKD. It develops as a result of the kidney's inability to regulate blood pressure effectively due to cyst formation. Persistent high blood pressure can lead to further kidney damage and increase the risk of cardiovascular disease. While the presence of cysts in the kidneys is the hallmark of PKD, the complications of this disease extend far beyond the urinary system. Over time, PKD can affect various organs and systems throughout the body. One common complication is the development of liver cysts. These cysts are similar to those found in the kidneys and are present in a significant portion of individuals with ADPKD. Cardiovascular issues are a major concern for individuals with PKD. The disease is associated with an increased risk of high blood pressure, which can damage blood vessels and the heart over time. Moreover, PKD can lead to heart valve abnormalities, making the heart work harder and potentially leading to heart failure. Another serious complication is the formation of brain aneurysms. These are bulges or weak spots in the blood vessels of the brain that can rupture, causing a hemorrhagic stroke. Kidney stones are a painful complication that can arise in PKD. These stones can cause excruciating pain and may obstruct the urinary tract, leading to infections and further kidney damage. Section 5. The genetic roots of PKD. Polycystic kidney disease is primarily caused by genetic mutations. These mutations are passed down from parents to their children. The most common mutations occur in two genes, PKD1 and PKD2. These genes provide instructions for making proteins that are essential for the normal growth and development of kidney cells. When these genes are mutated, the proteins they code for are either not produced or do not function properly. This disrupts the delicate balance within kidney cells, leading to the formation of cysts. The PKD1 gene is located on chromosome 16. Mutations in this gene are responsible for about 85% of all PKD cases. PKD2, on the other hand, is located on chromosome 4 and accounts for the remaining 15% of cases. In most cases, PKD is inherited in an autosomal dominant manner. This means that a person only needs to inherit one copy of the mutated gene from one parent to develop the disease. Section 6. Prevalence and impact on kidney health. Polycystic kidney disease is a relatively common genetic disorder, affecting millions of people worldwide. In the United States alone, it is estimated that over 500,000 people have PKD. This makes it one of the leading causes of kidney failure in the country. Globally, PKD affects an estimated 12.5 million people, highlighting its significant impact on global health. The impact of PKD on kidney health is substantial. As the cysts grow, they gradually compress and damage the surrounding kidney tissue. This damage impairs the kidney's ability to filter waste products from the blood, leading to a buildup of toxins in the body. Over time, this can lead to chronic kidney disease or CKD. CKD is a serious condition that can progress to kidney failure, requiring dialysis or a kidney transplant. PKD is responsible for about 2% of all kidney failure cases in the United States. Despite its prevalence and impact, PKD often goes undiagnosed, especially in its early stages. Section 7. Diagnosing Polycystic Kidney Disease. Diagnosing polycystic kidney disease, or PKD, often involves a multifaceted approach, combining a thorough medical history review, physical examination, and various diagnostic tests. Early diagnosis is crucial for managing the disease and slowing its progression, but it can be challenging due to the often subtle early symptoms. The first step in diagnosing PKD typically involves a detailed discussion between the patient and their doctor. The doctor will inquire about the patient's personal and family medical history, looking for any patterns or risk factors associated with PKD. This includes any history of kidney problems, high blood pressure, urinary tract infections, or family members with PKD. A physical examination is also an essential part of the diagnostic process. The doctor will examine the patient's abdomen, feeling for any enlargement or tenderness in the kidney area. They may also check the patient's blood pressure, as high blood pressure is a common symptom of PKD. Imaging tests play a vital role in confirming a PKD diagnosis. Ultrasound is often the first-line imaging test used. If the ultrasound suggests PKD, further imaging tests might be recommended to confirm the diagnosis and assess the extent of the disease. Section 8. Managing Polycystic Kidney Disease. While there is no cure for polycystic kidney disease or PKD, various management strategies can help control symptoms, slow disease progression, and improve the quality of life for individuals living with this condition. These strategies often involve a combination of lifestyle modifications, medications, and, in advanced cases, dialysis or kidney transplantation. One of the cornerstones of PKD management is blood pressure control. High blood pressure is a common complication of PKD and can accelerate kidney damage. Doctors typically prescribe medications to lower blood pressure and protect the kidneys from further harm. Pain management is another crucial aspect of PKD care. As cysts grow, they can cause pain and discomfort. Over-the-counter pain relievers like acetaminophen or ibuprofen can provide relief for mild to moderate pain. For more severe pain, doctors might prescribe stronger pain medications. Lifestyle modifications play a significant role in managing PKD and slowing its progression. Regular exercise is also crucial. Section 9. Looking ahead, research and future directions. The field of polycystic kidney disease, or PKD, research is continuously evolving, offering hope for new and more effective treatments in the future. Scientists and clinicians are working tirelessly to understand the complex mechanisms driving PKD development and progression, with the ultimate goal of finding a cure. One promising area of research focuses on developing targeted therapies that can slow down or halt cyst growth. These therapies aim to address the underlying molecular pathways involved in cyst formation, potentially offering a way to modify the disease's course. Several clinical trials are currently underway to evaluate the safety and effectiveness of these novel treatments. Gene therapy is another exciting avenue being explored. This revolutionary approach aims to correct the genetic mutations responsible for PKD. While still in its early stages, gene therapy holds immense potential for treating the root cause of the disease rather than just managing its symptoms. Stem cell therapy is also showing promise in the field of PKD research. Researchers are investigating the potential of using stem cells to regenerate damaged kidney tissue and restore kidney function in individuals with PKD.
Thanks for watching. Please like, share and subscribe. And remember to click the notification bell to know when future videos are released.